This next segment, I'm going to discuss animal and insect bites and scratches and stings. So basically, this next section is on interactions with mammals that might bite and scratch you, such as dogs and cats and humans, and then insects that might bite or sting you, like ants or bees. We're going to start off with mammals and discuss why one should be concerned with animal bites. So the main animals that humans get bit by are dogs and cats. And the reason for it is obvious, is because we live with them, and so there's lots of interaction. The third main animal that humans get bit by is actually other humans. So I'm not going to go into so much about other humans, but it is important to know if you interact and you draw blood from a human, or you have your blood drawn from a human, if there's blood-blood exchange or blood-saliva exchange with a human, it's important to understand if there's any potential diseases, because human-to-human diseases are pretty easy. Any disease that hepatitis, for instance, that a human has, another human can have. So it's different than what's called a zoonotic disease. That means like a disease from a dog to human. We share some infections, bacterial infections, but some of the viruses, for instance, that dogs or cats get, we don't get, and vice versa. So I'm going to start off with talking about pretty much dog and cat bites and scratches. And really, in first aid, it's much more about dog bites than anything else. The reason for it is people have dogs all over the place. And in large events, or even small events, when people go to music events and they bring their dogs, the dog is subjected to the same thing other humans are, which is lots of often noise and lots of people. The dogs just get confused and bite easier. So where a dog might be docile and calm at home or in a quiet place, all of a sudden you're walking your dog, then you're in a music event of some kind, or an herbal gathering, right? You're at some herbal conference and you're bringing your dog across, and there's other dogs, and that dog's just all hyped up, and somebody goes to pet your dog and they get bit because your dog is just kind of at its tether at that moment, and just ready to snap, and it does. And it could bite you as well. So dog, cat bites and scratches often get infected. When I've talked about yarrow as an herb specific for anything, I did talk about its use for dog bites. The reason is, anytime you get bit by a dog or a cat, or scratched strongly enough to draw blood by either of them, it usually just makes sense to preventatively treat yourself, both internally and externally. I'm going to say that again. If you get bit by a dog or a cat and it draws blood, you should probably treat yourself with some of the herbs. So I'm just talking about herbs here. There's a time when you might need stronger medical intervention, but a lot of these things, herbs will work really well. Once again, the thing about first aid and herbal medicine is that first aid events have been with us all of our evolution, right? Ever since the earliest organism. I don't know what happened when we were single-celled, but certainly since we've been many multiple-celled and bipedal, walking on two legs, we've been being food for other things. These days, we're not so much food for animals, other mammals. These days, we tend to be food for bacteria and viruses and proteins. That's going to go on forever, right? Those little things are going to escape our defenses. So instead I'll try to move away from my philosophy about humans as food and talk about what happens when we get bit or scratched. They're slightly different, but the reason that infections happen when you get bit or scratched has to do with the bacteria that's harbored in the nail beds of these creatures and in their gums, just like us, by the way. If you scratch somebody, you can get infected, and if you bite somebody, you can get infected, because our gums, and all animal gums, basically harbor a lot of bacteria. And when you bite something else, that bacteria gets deposited. And if it breaks the skin, and the more it breaks the skin, what's going to happen is that bacteria is going to get deposited even further deeper into the tissue. So instead of getting, if you rub, for some reason you like to rub a dog's gums, it's basically you have this epithelial layer. You have the skin, it's intact, no problem. But when the dog bites you, it is injecting you with these. So right now I want to separate dogs and cats, just to have a sense of why they both, what the symptom problems that they both carry, the health risks that both carry. They're a little bit different. Dogs are tearing animals. They do have some sharp teeth, but really when a dog bites, what happens, if you've ever watched a dog bite, is you have lots of really flat teeth marks that do a lot of local tissue damage. So as opposed, let me just do this. So as opposed to a cat who have two sharp teeth, when you get bit by a cat, you basically get puncture wounds. So with a dog bite, you have a lot of local tissue damage, but not always very deep. But it will take a while for your skin to reform from all that damage. Cat bites are puncture bites, and they often go very deep. Dog bites can, by the way, depending on how the dog bites you. But cat bites are often very deep, and they actually carry separate risks. So with dog bites, you just have, bacteria have a long time. Also, dogs eat poop, right? And dogs eat other stuff. And that, yeah, I don't know why dogs eat poop, and not all dogs eat poop, but I find it not the most endearing habit of dogs, though I do like dogs before I start getting hate mail from the dog lovers associations. But when dogs bite, whatever it is, you get a load of bacteria deposit, and you just have a lot of time for the bacteria to thrive because it takes a while for dog bites to heal, though they can be puncture bites too. They definitely can get somewhat deep. But cat bites, what happens with them is actually people sometimes get bone infections because when cats bite, those canine teeth, those feline teeth, go in pretty deep. And so you don't have a lot of local tissue damage. What you have is very sharp puncture wounds depositing bacteria ever deeper into your tissues. So sometimes actually cat bites carry bone infections. Dog bites tend to carry more localized tissue infections. The treatment, though, for both of these is going to be the same. But it's important to realize with a cat bite, you don't want it to close right away. Dog bites don't usually close right away. But cat bites can because they're just sharp puncture marks. I mean, they're bigger than like a spider teeth, which we'll talk about in a little bit. So what you want to do, and with scratching, both of those animals, like cats have really deep scratches. They have really sharp nails. Dogs, once again, dogs have kind of tearing scratches that take a while to heal. Cats have really deep scratches because they're very sharp claws, but both of them also deposit various bacteria into our skin that cause infection. So I've just delineated those two, but they're pretty much treated the same. And the first call that you want to do with all those is you want to soak the part of the body that was bit or scratched. If it's deeper than superficial, just go for it. Just soak it. So you're going to soak it in a strong tea of the disinfectant herbs that I talk about. The primary herb for me, to really, just from experience, is yarrow tea. So a crazy in this case means a very strong yarrow tea. Soak your scratches, your dog bites, your cat bites, your human bites, your weasel bites, your marmot bites in that as soon as possible. Keep the water hot. Like keep reheating the water because the heat will allow more healing process to occur locally on the tissue. So once again, hot baths of these various herbs, really of just yarrow, whenever you get a bite or a scratch. By the way, I keep pointing to my hands because the vast majority of dog bites are on the hands. And all the time I've treated dog bites, I've had one or two dog bites people have had here where the dogs jumped and bit them, or on their legs, sometimes on the butt. But the vast majority of dog bites are definitely on the hands, sometimes the arms. So, but the good thing about this is just easy to soak. Basically, the theme of this is soak your bites and scratches in hot yarrow tea. Other herbs are also disinfecting. You could put tinctures in hot water to increase their disinfecting properties as well. But the strongest thing is to just make strong yarrow tea. Strong chaparral tea are really handy. Echinacea will work too. If you have a lot of echinacea parts, just make a strong tea. But once again, my favorite is yarrow followed by chaparral. And then later on we'll discuss some of the other anti-infective teas. The thing that you don't soak it, I'm going to give you 3 seconds, I'll give you 3 choices. The thing to not soak your hand in is A, dog poop, B, comfrey, C, a McDonald's chocolate shake. And the answer is, that's right, all 3. But most likely, people will soak it in comfrey, hearing that comfrey heals. This is exactly the wrong time. to use comfrey. If you do soak your hand in comfrey, what's going to happen is comfrey does what comfrey does well, which is you'll get a quick development of epithelial tissue, skin, and it will block the bacteria deeper into your body, which could potentially raise your infections. I've seen it. So don't use comfrey at this level for any kinds of bites. Your goal is disinfect, disinfect, disinfect. Later, when the infection is clearly not going to happen, then you can move to vulneraries and healing your wounds. But initially, it's just a matter of disinfecting your wounds. So a few other things to consider. There's often trauma involved in bites, especially human bites, which I see just, I've only seen a scattering of human bites over my years practicing. But I've seen a lot of dog bites. And when people get bit by dogs, there's very often a sense of trauma. Like it just sucks, right? You're doing something and a dog runs up and bites you or scratches you, and it's just scary. They're big animals, they have scary teeth. And so often you want to give trauma herbs for folks, anemone or St. John's wort or a calamus. Those kinds of herbs often help reduce the trauma. There's often pain as an aspect, so you might want to give pain-relieving herbs because they can hurt, of course, getting bit and scratched. But I find that actually the trauma aspect is initially what I'm looking to work with. So pain, trauma, it's really, most of these things, if the scratch or the bite doesn't go beyond the superficial level, it's probably pretty safe. So everything I'm discussing here is if the bacteria gets deposited below the epidermis, and the deeper it is, the more you have to really look at it and worry about it. So I want to describe the signs of a localized infection versus the signs of a systemic infection. I've done this in other classes with external infections. I just want to say them again. So local infection, with dog bites, things get swollen, right? Cat bites too, but dog bites, lots of swelling. So you have swelling, often pain, tenderness, redness, and then pus. And all of those signs are classic that you have at least a local infection. If you have a systemic infection, it's often the same thing as if you had a viral fever, a virus like a cold or flu. You get fever, you might get chills, which accompanies the fever, and you might feel lethargy, or kind of a change of emotional fatigue, irritability. So if it's more than just that part of your body that hurts, it could be that the infection has gone deeper, and then you might want to treat it more aggressively, whether with herbs or with more conventional or modern medicine treatments. Other signs to look for in case it is a systemic infection, meaning internal, one of the classic ones is swollen lymph nodes. So if you have lymph nodes, like if you got bit on your hands, the most likely lymph nodes that would get swollen would be your armpits. If you got bit in the leg, the most likely glands that would get swollen would be your inguinals or inguinals right over here. But they can show up anywhere. So if you get bit, scratched, and you get swollen nodes afterwards, you have a systemic infection. Treat it more aggressively, however you're going to do it. If the person is immune compromised, I say this all the time because people are on immune compromising drugs, if they had a transplant, they're on immune suppressive drugs. If they're HIV positive, if they have hepatitis, they could be immune compromised. So just ask. I mean, most people know, do you have good immunity? If they're like, no, I have a disease that impairs or a drug that impedes my immunity. Also, steroids can impede your immunity as well. Now I want to go on to some of the questions you can ask people after you have it. So for this class, we're just going to assume that it's a local infection that might show up. We're not going to, systemic infections could be covered at another time, or just with other herbs that are generally used for systemic infections. So often you're going to get a quick history from the person who got bit. What bit them? So a dog or a cat or what kind of animal. In this case, you're going to know. I mean, it's rare that you get bit by a dog. It's not a spider bite here, right? You got bit by a big animal. You probably have seen it, and now you've probably watched it take off. Is the pet, is that animal somebody you know's pet? If it is, you can find that person and ask them questions. One of your considerations, especially with dog bites, not really with cat bites, one of your considerations with dog bites is you, as a community service-oriented person, you have a wild card on your hand. That dog, and I've seen this, dogs will just, when they're untethered and they're kind of insane from whatever makes them that, or they're just angry animals, they might bite a lot of people, right? So you want to get details because you might need to contain that dog. I'm not going to cover the ways to stop dog fights because that's common, and the ways to get dogs off of people, but it's a good thing to learn because it is something you need to know. The one thing I want to say about it, if you see a dog bite somebody, don't get between the dog's mouth and who they're biting. You're just going to get bit. So there's a couple of ways to do it. There's some great information on the web and other books for resources. But if a dog is biting person, don't put your body in front of them because you'll get bit. So there's other ways to deal with it, but be careful. I mean, you getting bit doesn't really help it. I mean, there's other situations you can figure it out. If it's a child, what are you going to do? But there's just, I've said it too many times, be cautious about getting bit yourself. So if you know the person who owns the dog, whether they're a friend or somebody at a camp nearby, you want to talk to that person. You want to find out if it's a rare instance, if the dog's angry, if there's something wrong, if the person has tied the dog on too short a leash, whatever it is, to help stop that dog biting other people. So that's one part of it. The other thing is, does the dog have shots, right? If that dog is just loose and wild, is it rabid? Does it have other diseases it can spread? So I'm not covering those diseases, especially rabies here. I'm just talking about bacterial infections. But if most of the time you don't catch the dog that bit you, you don't hold it. I have seen that, but often you don't. Because you have to be pretty brave to do it. If it has a collar, I mean, there's times to do it. And sometimes dogs just snap and bite. So, I mean, with that instance, if the dog just snaps and bites, probably that dog might stay right there and you can figure it out. But if the dog's aggressive, you might not know it well, and you have to know if you have serious risk of a worse disease going on. So find out who owns the dog. And it's a not comfortable position of confronting dog owners. Sometimes, I mean, most people love their dogs no matter who their dogs are, which is nice, but it's a problem when you're saying this dog bit this person and the dog owner said, it didn't bite. My dog never bites anybody. And the person's like, well, that dog bit me. So that's a whole other scenario. But anyway, find out if the person knows who owns the dog, you know, the dog's friend. We'll just say owns the dog here. Where's the location of the bite? And make sure it's not just one bite. Sometimes somebody will get bit hard and scratched or bit elsewhere, and you have to treat every place where the skin's been compromised. So sometimes the person will say, I got this bite, and then you look at them and they're bleeding elsewhere. So just check out any place that person might have got bit and scratched by asking them. Is there, take a second, take a breath. Is there any place else where you might have a bite or a scratch? What's the felt depth of the bite? That person got bit, because you can't always see how far it is, especially if there's a lot of tissue damage. So if they feel like, wow, that thing might have crunched my bones, I mean, it just might potentially be a deeper bite. And of course, it could just be an exaggerated statement because it hurts. Another question is, are other people in danger? So this goes back to, where is the animal now? Where is the animal now? Are other people in danger? What are we going to do with this animal if it's running loose? And I'm telling you, it's not easy, because people, when you take a dog and tie it up and it's somebody else's dog, you can really sometimes get yelled at. I mean, I have. But for me, it's, I get yelled at, and it's annoying, but my goal is more for the larger community. I'm not hurting the dog, I'm just making sure other people don't get bit, if I can take that into account. Better to find the person who travels with the dog to help there. So we've talked about the outline for dog, this also cat bites, but cat bites really aren't a part of any of this other scenario. I mean, I just haven't seen wild cats in first aid situations biting and scratching everybody. I mean, usually cats just take off by themselves that are like that. And there's just less cats in these situations. When I talk about treatment, though, cat bites and scratches fit in very well as well. So, what to do for the bites? The first thing is look at them. Try to figure out the extensiveness of the damage. Try to assess the person who got bit and how healthier they are, like how well they're dealing with the situation. If you're going to be probing, and you probably will, get your gloves on. Gloves on, start probing, because there's going to be, if it's broken their skin, there's going to be serous fluid leaking and maybe a bunch of blood, and so don't touch that. Remember, again, you could have infections from somebody else and put that in them. So wear some gloves. Is there collateral damage associated with this? So the problem, especially with dog bites here, is that they can break tendons, and I mean, they can just, when they bite, it could be more than just skin breaking. So did they, have they reached a tendon or a bundle of nerves? Have they reached other muscle groups where you have now damage to your muscles? Like if they bit the back of your leg and they hit a strong muscle group, it might be difficult, like right in over here, might be difficult to walk, and you might need restorative surgery. So how extensive is the bite? Here, scratches are less important. Scratches just tend to damage the local tissue. If it's a cat bite, is it really deep? And that's going to affect the treatment for a cat bite. So your first thing is to debride the area. So debriding means taking out dead, torn tissue. With other injuries, there's often a lot of dirt. In this situation, it's not so much dirt, unless they fell in dirt. The bite doesn't deposit dirt. The bite deposits bacteria. So soak it, and then if there's a lot of dead tissue, you have to remove it. That stuff just gets in the way if it's unattached and dead and dying. And so razor blades and tweezers, be careful because it's a really sensitive area, but you're basically going to have to cut off any dead tissue, which actually could be a bit of fun if you like doing this kind of stuff. So soak it, give the person trauma aids, pain medicines. If they don't want to watch, they don't have to. You could work on their hand, not directly. It doesn't usually hurt that much. The damaged dead tissue, when you pull it up, so I don't have damaged dead tissue here, but when you pull it up, it only hurts where it's attached to the skin. So when you pull it up, don't pull it hard where the nerve endings are, and then you can just cut around it. Usually I use a razor blade or a scalpel, really something really sharp. Really sharp scissors work better because you use the scalpel, you're putting pressure as you apply. But if it's really sharp, you can just sear it off and throw that away in medical waste. That's dead tissue now, with your gloves on. So probe and search for any foreign material. Clean and irrigate the wound thoroughly. If it's a cat bite or a puncture wound, get out your irrigation syringes. In this case, like I've talked previously about using an irrigation syringe and just initially putting soapy water in a wound. Here, just put disinfecting herbs like golden seal tincture in there, or echinacea tincture, or myrrh tincture, whatever it is. At this point, it's a matter of disinfecting. It's not a matter of really just trying to bring stuff out. So when using irrigation syringe, let's say put a couple of dropperfuls of golden seal tincture in some water, pull that up in your irrigation syringe and clean with that. You will waste some tincture because some of it's coming out, but you might as well just start disinfecting right away because that's really your goal here. That's your big fear, so you can get an infection. They can get nasty, by the way. Dog bites can get really puffy and nasty and take a long time to come down. I mean, I'm saying all this from personal experience being around dogs. I still like dogs, but honestly, I wish people would take much better care of their dogs and not bring them to some of the events that just are very disharmonious, and the dogs just go crazy because they're just surrounded by so much noise. So dogs that are good for that are fine, but other dogs, they just bite easy because they're just scared all the time. They're out to, so I think you probably understand what I'm talking about. As far as are you up to it, if they get an infection, I would say within 2 to 3 days tops, you should be able to start getting the infection under control. So they get bit, and they don't get, so if they get bit and you treat them right away, they might never get an infection. What happens commonly is they come in a day or two later with the bite, and the infection is really seething at that point. And then I would say if it's getting worse 2 days later rather than better, I probably would suggest more conventional care, or at least somebody more professional who's worked with it. So all those protocols are just made up right now on the spot. But generally after 2 days of an infection getting worse, I'm thinking, the herbs aren't working. I mean, you could try different herbs, but after 2 days, let me add an addendum. This is 2 days of working with somebody who's compliant and actually working with you and taking the herbs. If they're not taking the herbs, they should probably just go get antibiotics or something. I mean, just so they don't get an infection if they're non-compliant with herbal regimens. So your initial treatment strategies for this is treating the obvious symptoms: bleeding, pain, trauma. So initially, just like who they are and what they need right there, right then. So once again, bleeding, pain, trauma. The second is going to be disinfecting. Really, I think that hot strong teas of yarrow or chaparral or other strong disinfecting, not demulcents, not comfrey, are really handy here. Try to have them soak the affected part or compress the affected part for at least 20 minutes at a time, at least twice a day. So that would be my minimum. 20 minutes in hot water, in hot tea, twice a day, or compress twice a day. It's not a poultice. You're not going to put the herbs directly on it because you want to wash anything out. And do it for at least 3 or 4 days. Twice a day for at least 3 or 4 days. You're also going to give other medicines, but that local disinfectant soak is really important. So you want strong teas in this. You can put tincture in the water, but teas are a little bit stronger here. You might also add astringent herbs, which are helpful as free radical scavengers. And they will help skin men, but not initially, because they're not so much cell proliferants, astringents, pulling tissue tighter, but initially they also have some disinfecting qualities. So things to consider would be like blackberry roots cut up and boiled, witch hazel branches, oak, and oaks grow in many parts of the United States. So you got to decoct those, as we mentioned previously. Decoct those, cook those plants in really hot water, boil them for about 15 or 20 minutes, and add them, if you like, into your yarrow or chaparral teas. Now internally, the person should start taking innate immune stimulants. You want to start increasing their innate immunity to fight infection before it gets there. Once again, as you know from me, echinacea is my favorite. And I would suggest high doses, 1 to 3 droppers every 2 to 4 hours. 1 to 3 droppers every 2 to 4 hours for the first day, maybe 1 or 2 droppers every 4 hours the second day, maybe 1 dropper every 4 hours the third day. So lots often, still pretty good amounts, a little less often, then a little bit less, not as often. So I hope that was understandable. But so basically, initially, 1 to 3 droppers every 2 to 4 hours, and then half that, and then half that again over the course of 3 days. Keep it up, though. Make sure they have a bottle, right? Otherwise, they might not be able to come back and get the medicine over and over again. So they should have a bottle of it with them so they can constantly take the echinacea. I would suggest also in the echinacea, also adding osha and Oregon grapefruit or golden seal. So a berberine-containing herb plus osha could be useful in there. By the way, myrrh tincture, which I haven't talked about much, but so I buy myrrh. I don't gather my own myrrh. It would be very nice to gather myrrh. It's basically you have to find trees in the Burseraceae and scratch them and gather the resins. The next herb, by the way, so we have echinacea, berberine-containing herbs, myrrh, and also baptisia. Baptisia is wild indigo. I haven't covered it much, and I won't, but baptisia is a great herb. It's antibacterial and antiviral. It's one of my favorite to give when people have infections, either viral or bacterial infections. If the person has any kind of adaptive immune problem, if the immunity is weaker, you can also start them up on teas. You can use tinctures, but teas are stronger here. Echinacea tea, astragalus tea, and the reishi mushrooms, the Ganodermas. So echinacea is already being used elsewhere, so I'll just focus once again on astragalus tea and reishi tea. You can also, by the way, you can buy reishi powdered or astragalus powdered and just add them in water and drink them. So instead of making a tea, like if you buy astragalus root powdered, you can take the astragalus, put a teaspoon in the water, just stir it and drink it, and you'll get some of it. So it's another way of getting it down. And that's easier when you're camping or out at events where you might not have access to tea equipment. By the way, you as a first aid person should have access to tea equipment. And I have one of those propane burners. So basically I have a propane tank. So it's not the best ecological one, but they're the easiest to use. So instead of one of those dragonflies or one of those other smaller burners, I have one of those, I can maybe bring it in later, but I have one of those propane top burners, and then I have a propane canister that goes into it. So I can sit pots on top of it. But it's really helpful. And it's important for me because I make a lot of tea when treating people. So we have external medicines in the form of soaks and washes. We have internal medicines in the form of echinacea and baptisia and myrrh and Oregon grapefruit. And now we want to start putting something local. So we take the hand out of the wash and put an activated charcoal poultice wherever it was. If it's really deep, it might not work because activated charcoal has to come into contact. But if it's not very deep, like most dog bites, so when I showed on Christian's hand how to take the activated charcoal and make a slurry with it and put it on a gauze and put it flat on there, make sure it comes into direct contact, and then change that once a day. So activated charcoal poultice, at least once a day, but it's better twice a day. So basically every time you re-soak your hand, you change your activated charcoal poultice. You won't use very much of it up. I mean, activated, like that amount is just a couple of cents at best, right? Unless you're opening up capsules, which is really expensive, which capsules are helpful internally, but here you're gonna spend a lot of money. So when you wrap the hand up, so let's say you make an activated charcoal poultice on that, when you wrap it, don't wrap it very tight. This is not a matter of trying to stop a sprain or a strain. If you wrap it too tight, what's going to happen is if it gets inflamed, which is common, it's going to push against there, and that's going to impede healing. So when you put your vet wrap, so you put your charcoal poultice down and then vet wrap or one of those self-stick wraps on there, you want it tight so it holds it on there and so dirt doesn't get underneath. But you don't want it too tight to impede circulation, especially if they get inflammation. That's always a consideration with wounds. Tight, but not too tight. Different than sprains and strains where you're trying to constrain a joint from moving around too much. So you can use other herbs locally. You can take some golden seal, a tincture, not powders. Right? Powders, if you put them in a wound, especially a puncture wound, they're going to impede the healing. So you can put tinctures on a cloth gauze and put that directly on. You can put some echinacea, some golden seal, Oregon grapefruit, myrrh, yarrow tincture, chaparral tincture, not so much teas. The problem with teas is there's a lot of water in there, and that water kind of gets absorbed locally in the skin, and also is not quite as good. So you want, when you put a wrap on, when you put a compress on, or I guess when you're putting a gauze next to the skin, really what I'm talking about, is you can make a lightly soak it with an anti-infective tincture and put it on directly, and once again, put their vet wrap. So golden seal is a good one. Echinacea is okay, better internally. Oregon grapefruit is good locally. Myrrh is good locally. And there's probably a bunch of others. When we get to the list, I'll remember them and I'll bring them up. Chaparral, especially as a tincture here. Scratches, the same as bites. The thing about scratches is they don't get infected as much because they're often not as deep. There is cat scratch fever, but I don't see that lot as a first aid event because that happens after the scratch. It can happen weeks after. But for any kinds of scratches that you're worried about from animals, it's really the same. Soak it, activated charcoal poultice if it's broke the skin, take it out, and then take those herbs to stimulate innate immunity and help kill stuff. Make sure you check it frequently. And I think that's pretty much it. I think with this, you can treat lots of dog bites. I'm not sure how many of you will run into them, but I've had a lot of success over the years, and I'm suggesting that this can be really helpful. And good luck with dogs and cats. You don't have to tell me, but the way that people actually break up two dogs, a dog that's locked onto another dog, is kind of interesting. And I know people that have done it, and I'm not going to say what it is, but when you look at it, you'll know what I'm talking about by the smirk on my face. So thank you for listening to this.